Hello, everybody, and thank you so very much for coming to our live event. As you know, Kim and I were featured on the Doctor's Show not too long ago, where we discussed the little-known cure that I have for migraine headaches. So now we're going to go into talking about a little bit more details that we weren't able to cover on the show that we'd like to share with you today.
Well, as you know, I suffered 41 years from migraines, and I really was angry when I found out about Dr. Kevin Smith because I had looked for a solution for so long. I only live an hour and a half away, and yet I'd never heard about his procedure and how it could cure my migraines. And I am so very thankful to be here to share my story with you, and thankful that I found Dr. Kevin Smith. You know, what I want to share with the migraine sufferers is more or less a little bit more of my background to see if maybe they can relate to some of the symptoms that I had.
Great. I think that's very important. You know, everybody has a different experience, so let's hear what you had.
Well, I was your classic migraine sufferer. I had all the classic symptoms. Throughout my 41 years of having migraines, I'd probably had several doctors, many doctors, ask me if I'd ever had an injury to my face, and my response was always no. I just couldn't recall anything. I remember having a neck injury when I was about 15 when my headaches started, and of course...
Hold on, not just a neck injury. That was a gymnastics injury,
Right.
And you mainly hurt your neck, but you probably could have hit your face.
I do remember when I started thinking back about that I remember coming down on my knee, and I think this side of my face was actually a bit sore, but my shoulder and my neck hurt so much more that I really was more focused on that. So it probably did occur then. Just like so many other people, I wasn't aware of it.
That's true. Oftentimes it's the injury to the nose that causes it. But sometimes, you know, you get more severe injuries and you focus on those and forget about the nose before long. But please, go ahead.
Well, even after that injury, you know, I've never had any sinus problems. I've never had any breathing problems, but I guess some of your patients do and don't.
Yes, some patients do. It varies from patient to patient. Some people think because it's a problem in the nose, a deviated septum, that, oh, I should have breathing problems or snoring, I should have runny nose. But Kim's classic, you didn't have any of that stuff, right?
No,
Nothing.
not any of that.
Just the headaches.
Just the headaches, and they were severe and debilitating, just like the video says in the doctor's TV show. And I know a lot of migraine sufferers who suffer the same symptoms that I do that hopefully will be coming to see you soon.
How do we get them to come, though? I mean, it seems that there's a disconnect. Why should they see an ENT doctor for migraines? I think that's what the issue is, don't you?
Well, I think if you research migraines, and I've been on this journey for a long time, I think a lot of the medical doctors are taught that migraines more or less have a neurological origin, not a physical origin. And you are addressing it from the physical injury that's causing the migraines, just like you did with my deviated septum. I think that is new, and that makes it revolutionary, and just like the doctor's TV show said. But I also think that a lot of people like me just say, oh, well, that couldn't work for me. And we've talked about this before. You know, I was a little skeptical even coming to your office. The background,
most people are.
Yeah, the background story for me was I live about an hour and a half away from your office, and I was walking through the living room one day, and I heard someone say migraine surgery, and my husband was sitting in the chair, and I froze for just a moment. I'd never heard of a migraine surgery because through my 41 years, all that happened was doctors loaded me up with medicines,
Right.
most of all that I couldn't take. So once I saw you on KHOU TV Houston doing a surgery on a young girl that had been homeschooled her entire life because of her pain, and of course now she has the same results that I have, 100% cure.
Right.
When I saw that, and even though I didn't know the aftermath exactly, I said, I'm going to go see him. Still, when I arrived at your office, I wasn't sure I was in the right place, but once I got in your office and talked to you and you explained to me how you had addressed the symptoms, and you immediately could tell there was something wrong with my septum, and I had the CAT scan, and thank God, you know, you did my surgery, and it has been amazing. I just have so much energy, and I can't thank you enough.
So you have a better quality of life. I hear people always talk about quality of life. That's what I'm doing. I'm improving your quality of life. And that's something that I think is very important. To live less than your best life, I think, is a travesty. And I take great pride into doing my best as far as giving you your life back.
And you did that, absolutely. But what you do doesn't only just affect the person you're doing the surgery on. It affects my entire family and everyone that encounters me, because now I have an opportunity to give them my full attention with a lot more energy. I mean, I just have so much more energy because I'm not reserving all this energy every day to fight migraines anymore. I'm just so excited. I'm smiling more. I'm more happy. Colors are bluer. Food tastes better. Reading a book is more entertaining. I love work more. I mean, everything is just better.
That's good. Well, that was the whole goal. I think going back to what you were saying about getting the CAT scan and finding out you had a problem in your nose, if I can give some facts and figures about everything, when you typically go in to have your migraines evaluated, doctors will get an MRI of the brain or a CAT scan of the brain. That only looks at this part of the head. And before you get the diagnosis of migraine, you're dealing with head pain in a sense, and I think that migraine should be the very last diagnosis you should be tagged with when everything else is normal. But when you go to get these scans of the brain, only 5% of those are abnormal and have some finding that can be fixed. That means 95% of scans done on the brain of all migraine and headache sufferers are normal. And I've had people that have told me they've had up to 14 normal MRIs of the brain before they came to see me, got their CAT scan, and found something positive. So the take-home message here is that when you go to get evaluated for a headache or a migraine, I think it's very important that you insist that you get a CAT scan of the sinuses. Send it to me, I'll review it, and I'll tell you if you have what I call the migraine imposter sitting in your nose that's been just giving you all this pain all your lives that can be easily fixed. The procedure is covered by insurance. Mm-hmm. It's a pretty easy recovery, I think. Why don't you tell them about your recovery? It's been, a month now?
Yeah, it's been about 4 weeks. It was a day surgery. It was very easy. It wasn't a long procedure. I think you and your staff did a really good job preparing me for everything. I had everything on hand that I needed at home. Y'all followed up with me to make sure how I was feeling. I've had other major surgeries in my life, and if I had to have this surgery 10 times to not have migraines, I would have done it.
Oh, good. Yeah, it's kind of hard to tell people that it really is an easy process. How long did you take your pain medicine?
About, maybe 5 days.
Yeah.
Not that long. And you do have the effects of, some sinus and stuff afterwards, but it's compared to migraines, it's just not that much of a consequence.
I've even had some people take no pain medicine afterwards because the migraines are just so bad that the pain from the surgery was nothing. I even call it discomfort. It's really not pain, it's more of a discomfort. Would you agree with that, Kim?
Yes, and to be honest with you, I think that it's not the surgical part that bothers you. You have to kind of keep yourself elevated. And I'm a tummy sleeper, so that was really hard for me. But outside of that, lack of sleep, it wasn't significant.
I tell people all the time, that's the number one complaint. How long do I have to sleep with my head elevated? It's not about the surgery or the anesthesia afterwards or
That's right.
the discomfort after the surgery. It's about when can I sleep flat? And the good thing was you were able to fly out to L.A.
I did.
Just, a week after your surgery,
Yes,
correct?
I did.
Yeah,
when you see me on the doctor's TV show, I sound just as normal then as I do now, and that's only, like 10 days after surgery and after a flight, and, just not a problem.
I think it's good to point out here as well, when you Google, and we've talked about this, and I want you to
Yes.
expound on this. When you Google septoplasty, migraines, you'll get horror stories. And I try my best not to pack the nose, which makes it comfortable. There was a time when you get yards and yards of packing people will talk about.
And splints. You
And
don't do splints.
I try not to. When I need to, I will, but when I try not to, though. And that just makes it very comfortable for the patients.
Yeah. Really for the first 2 or 3 days, you might have a little piece of gauze around your nose, and you're mostly sleeping anyway and resting. and it's just not a lot of discomfort. But I can remember perhaps one time during that 41 years that maybe someone mentioned to me septoplasty. And because I was pretty thorough about researching all avenues, I went ahead and did Google, and I recently Googled it again. It doesn't look much different. Septoplasty and migraines, the reason it'll scare people is because it'll say they had a septoplasty because they were having sinus problems and now they have migraines. And if you're a migraine sufferer and someone tells you that a surgical procedure is going to cause migraines, you run.
That's right.
But the difference is you've had how many years experience in this?
20.
And your procedure is not just a standard septoplasty.
I'm glad you said that. It really isn't. This is not a standard septoplasty. This is a very technical, highly refined procedure that I've developed over the 20 years with my experience and over 2,000 patients. It also provides patients with a 88% success rate. So you have a very good chance to get rid of these headaches when we discover that you have a problem in your nose. So just to go and to try to find a doctor that does a septoplasty is not going to be good enough. Mm-hmm. I've had people come to me who have had septoplasties before and still have headaches. I've tried to be nice, take my report and go to see a doctor that understands it, but I can't take that chance anymore. I'm the authority. I've been doing this 20 years. I know the process and have developed the Smith technique, which I call the Smith Migraine Imposter treatment for headaches. And it's something I've come up with and developed. It's very specialized, highly specialized, and I'm very proud of it because it gives results like this. Someone who's gone through life 41 years with migraine, and then you come to my office, and the good thing is that day, we will tell you, the day that you come in, if you have what I can fix or not. It's not a guessing game. It's not a crapshoot where we're trying to see if you might get better. I will scope your nose. You'll be able to see on the monitor. I'll point out to you if you have a bone spur in your nose and any other abnormalities that are there. So it really is more of a seek and find and get to the root cause of the pain. And that's what I pride myself in. Would you say that's correct?
Oh, yeah, that was my experience exactly. I think when I went to Dr. Smith's office and he told me, yes, you have a deviated septum and all we need to do is a stay surgery, I just held my breath because, this is a 41-year journey and I just didn't really think it could be possible. And it's so exciting to think that you could be migraine-free from a simple day surgery. It just doesn't seem possible. But it's real.
It's real.
Amazing.
It is real. And when you really think about it, it's very logical. The body is put together in a wonderful manner. And to have pain in the head requires that you seek all the possible options that cause that pain. And what I do is that I look at the nose and the sinuses because I know that when you have contact between the rigid septum, let's just look at some anatomy. The septum is a midline partition that divides the right nostril from the left, and it's made up of cartilage and bone. But also in your nose, you have these soft tissues that are very dynamic, meaning they actually have some motion to them. They don't stay fixed. They're called turbinates. And when you're exposed to things like gasoline fumes, perfume, detergent smells, red wine or chocolate, these turbinates will react to those things. Well, in a normal nose, they're just reacting. You're tasting all the things like you should. You're smelling things that you should, and you're going about your business. But in a nose that has been injured and has a deviated septum, that's when the swelling, the normal swelling that takes place with these so-called triggers, then cause the migraine. So hormones are blamed for the migraine, perfume, Coca-Cola, red wine, chocolate, and you try to avoid all these things when really what you need to do is find out why those normal things that people are always exposed to is causing the pain. And that's where I come in. I actually do the investigation and get to the root cause of the problem and make a thorough examination of the nose. Matter of fact, I had a woman in my office just the other day who drove from Tennessee to Houston to see me because she had migraines. And while I was looking in her nose, I got a little concerned because she didn't have a large bone spur like Kim had. But as I look more and more, I see this little small sharp projection off of her septum, way in the back of the nose that could have easily been missed by anybody else. But because of my 20 years of training, I picked up on it, and while I was in the office, I just kind of moved it over just to see how she would do. And the next morning when I saw her to have her procedure, she said, "I don't know what you did in the office, but I woke up this morning so much better than I have in the last several decades." So it's just little things like that that you have to pay particular attention to. And the same is true when you get a CAT scan of the sinuses. You can't just take it to anybody. You can't just read the report where it says that your septum is midline, because in fact, some reports don't even mention the septum. That CT scan that you get of your sinuses needs to be sent to my office, and I will review it and get back to you and tell you if you have something I can fix. And then we can move forward with having you come down, have the procedure scheduled, see me, and stay over a few days and then head on back home, headache-free.
I think those are really good points, but I want to ask you to talk a little bit about some of the chapters. My favorite part of your book, you have a book called The Migraine Imposter, and in there it talks about referral pain.
Yes.
You know, just because my pain started in my nose and went straight to my head, can you expand on that a little bit?
I sure can. When I was writing my book, I came across some journals that talked about studies done by other ENTs as far back as 1940. And what they did, they took these patients and they had this electric current, and they would just put a little bit of stimulus in the nose in different parts and map out where people would feel their pain. Temples, forehead, top of the head, cheek, eyes. And they mapped this out. And so when I came across it, I was very fascinated. But when you really think about it, who gets an ear, nose, and throat journal? Doctors do. You can't get access to that. Mm-hmm. It comes to me. And after a few years, those things are put up on a shelf and nobody has access to it. So it's just because I was researching for my book that I happened to come across this information. And so I used that in my book to show when you have contact in the nose at various points, how it then can refer pain to your head and make it appear as though you're having headache and migraine.
What about people who feel like their migraine started in the back of their neck, or they're hormone related, or what about those patients?
Well, I can tell you the trigeminal nerve is the main nerve that supplies sensation or you can feel things because of that. And that nerve is going to supply everything from the ear forward, okay? The back of the head is another nerve. So it's my belief, though, that when you get headaches here, your muscles will tighten up and put pressure on the occipital nerves in the back, and that's what causes those headaches. You're tensing up.
And
you're not feeling good.
I had a lot of those, too. Yeah. I had a lot of those, too.
So I attribute that to tensing up and attributing to the stress headaches people talk about. Mm-hmm. Mm-hmm. As it relates to hormones, estrogen in particular, when they go high, when they get elevated during times of menstrual cycles, it causes the turbinates to swell. And again, if you have a mild deviation of your septum, during the other 3 weeks of the month, there's no contact. But as soon as that menstrual cycle comes on and the turbinate swells and makes contact with the septum, then you have a problem, because now it's referring pain to the head and causing these severe headaches during that time. So that's my explanation of a menstrual migraine.
And all the patients that you've treated, I'm just interested personally, mm-hmm. and maybe for people watching this, are all of your patients that have had great success, are they all injury patients, or some of them, can that have been genital, since the time they were born, have a deviated septum?
That's a very good question. Let's talk about the incidence of deviated septums first. 27% of newborns have a deviated septum, and the reason that is because the first trauma is when we all come through the birth canal. Now, some of us, of course, are delivered by C-section, but of course, before you get a C-section, you probably had to push several hours and couldn't get through the canal, and that's why you had a C-section. So that explains some of the injuries that you may not remember or recall. And then there are other little subtle hits to the nose that you won't even make mention of or even remember. But certainly I think a majority of those deviated septums are caused by some type of injury to the nose. As we get older, 44% of adults have a deviated septum. So you go from 27% of newborns to 44% of adults. And that's because, you have other traumas that come along, sports injuries, bicycle accidents, car accidents, things of that nature. But I'm sure there are families, probably a small percentage of families, that for some reason or another have a nose just like the outside of the nose might look characteristically the same in a certain family. The inside of the nose is likely to have the same, and I'm sure that some of those people can have septums that instead of growing straight, they grow off and bend and cause problems. And this then would throw you into that category of patients who have hereditary migraines. But right now, hereditary migraines are just almost like a death sentence. Oh, it runs in your family. You have it. Here's some medicines. Let's try it. But we really don't know what causes it. And my thing is, even with hereditary migraines, you need to come in and be screened, get a CAT scan of your sinuses. The take-home message is to everybody out there: don't try to self-diagnose and explain why you have the migraines that you have. Just get the screening with a CAT scan of the sinuses, send it to me, and let me tell you if you have a problem. Let me do all the thinking. I want to take the thinking out of your hands. Let me do all the thinking for you.
I agree. After 41 years, I can look back now and think about the mistakes that I made and the things that I should have done sooner. Again, when you go to a neurologist or you go to most doctors, they're going to tell you that it's probably a neurological problem. Back then, they thought that it was blood flow in the brain that caused a lot of migraines. That's why the tryptophan drugs would work for some migraine sufferers like me. And also, most recently, they are saying they think they're hereditary, which goes back to what you just said. Mm-hmm. But the mistake that I made was I'd never realized there could be a physical cause or, that could possibly be causing my migraine. And if I ever was, told that I had a physical cause, if anyone would ever mention deviated septum to me, that would not have rung a bell. It wouldn't have meant anything to me because I didn't have the knowledge to know that could be the point of all that you have so many nerves there that can be affected.
I was hoping you would say that. That's the key. Mm-hmm. Understand that all parts of your body have nerves. And if you have something that's pinching on a nerve, it's going to cause pain. Mm-hmm. People understand bone spurs in the neck or bone spurs in the feet that cause pain.
Right.
You can have a bone spur in the septum, in the nose that causes pain too. And so let me ask you then, Kim, what would help you make the connection? Anything? Or this conversation we're having now? Did you understand that there are nerves in the nose?
Well, I think that's what I would want everyone to know. I've already told you the story about how I walked through the living room and someone was on video and explaining how they had a migraine surgery. And that's what I'm doing today. I want to pay that forward to the people that need to know why I'm here today. I'm not receiving any compensation. I've not asked for anything. But, this miracle has happened in my life, and that's Dr. Smith and his artful hands. And I just want to see everybody have the same relief I have. This is not everyone's answer for migraines, but what if it's the answer for 80% of migraine sufferers? We just don't know. We don't know.
And that's what excites me about this. I'm glad you mentioned about the compensation and things like that. This is truly a love of mine. I hear basically the same story from everybody. Over 20 years, always, I have these severe headaches, I'm disabled, I have to go to the emergency room, I have to get a cocktail of medicines, I've been hospitalized for a week and on a trial with a neurologist that put me on all these meds, and when I got out, it was the same thing. I get labels as a drug-seeking individual. People at work call me lazy. I can't have a migraine every day. My spouse says, you can't have a migraine every day, so they get unsympathetic. And then you get into the depression or the side effects from the medications where you don't feel yourself. And unfortunately, there are those who are out there who are suicidal, at least considering that as an option because the pain is so severe. So for me, I hear this story over and over and over again. But I get just as excited when Kim came through, as the lady from Tennessee who came in, as the person who's going to see me tomorrow is going to come in. The story's pretty much the same, but it is a little different. And the one thing that changes is the number. I've been suffering 5 years, 10 years, 20, and in this case, 40 years. And so I get the same excitement because I'm just like that same little curious kid I've always been when I was in grade school. I want to find out what this is all about. And I want to make a difference in people's lives. So when I have somebody who comes in my office smiling like you did today, wearing these beautiful bright clothes, and I can tell she's just feeling different.
It's like being born again. I borrowed that from, or I said that, and it was the same thing as one of your other testimonies on your website.
Yes.
But it is truly like being born again.
So can you imagine little old me, Kevin Smith, from Dallas, Texas, happens to want to be a doctor, goes to medical school, trains and gets into ENT. I didn't even know what ear, nose, and throat was when I was a third-year medical student. I heard people talking about it. But I get into this, and I hear my preceptor during my fellowship in facial plastic surgery say, you know, Kevin, on some of my patients that I do a rhinoplasty and a septoplasty on, they tell me that they don't have bad headaches anymore. And I just kind of listened. And he said that maybe 2 or 3 times during the year. I was just there a year. He said it 1 or 2 times. I take that and run with that information, and because of that, I meet you and another 2,000 individuals, and I get to change their life with a 30-minute to an hour procedure. I'm still amazed at it. I really am.
Yeah.
I'm really amazed that I can do that, which is why I'm doing my very best to do this video, to reach out to everyone out there. And I know you're going to be doubtful. And I know you're wondering, what's the catch? And I know you're thinking, it's one more doctor. But in this case, what would you tell them?
Well, first of all, I would tell you this story is really real. Everyone who's ever known me knows about my migraines, and that's why I think they're all just, cannot believe I don't have migraines anymore. And I can tell you that Dr. Smith, I do my due diligence when I have anything done. I did all my due diligence. I read the books. I went through the webinars. I, looked at everything before I decided to have the surgery. And I was very confident that Dr. Smith, he's very, very conservative. Even though he does the surgery, he's a very conservative physician, and he makes sure it's done exactly right, and he tries to do everything he can the very first time to solve those migraines. And he has for me. And I just challenge anyone just to give him that opportunity to please look at that. Send him a CT scan. If you're out of state, it doesn't mean you have to travel to Houston, Texas and visit him in his office. Just send him the CT scan and give him the opportunity to look at that and to see if he can help you too, because it is amazing. Dr. Smith, when you talked about your 88% cure rate or your ability to help migraine sufferers, give me the breakout of the percentages that have 100% cure like me. What are the other people experience?
Okay. So of that 88% success rate, and I label success as either a cure or markedly reduced headaches, 40% of those are cured, and another 48% of those have fewer or less severe headaches that they can take Tylenol or Advil for that they once could not. I've had patients who say when they have their migraines, they get a little weakness and slurred speech. They get a little weakness in their arm. And at first I was like, well, I don't know if this is quite a migraine that you're having or if I can help, but it did. These are those complex migraines they talk about. What exactly were the aura that you had that went with your headaches that now have been cured?
I don't think I've ever talked about this with Dr. Smith, so I'm going to tell you what my aura looked like. You have to go back as a child when you ever looked through the lens. That in science class they'd say, this is what the lens of a bee looks like, and it has all these octagons that are connected. That's what mine looked like. It would be transparent, but it'd have all the octagons, and they would be pulsating like this. So that's what my aura was. That was my signal, and I didn't always have a migraine every time I had the aura, but what that aura told me was, you might get a migraine. It might be coming on, and it could be intense. So start gearing up.
But did you have this light sensitivity we talked about?
Light sensitivity, sensitivities to smell.
What smells? Let's just go into them. Let's just.
Okay, well, anything that had, I've raised a teenage daughter, and, she had a separate end of the house and her own bathroom, but, hairsprays, lotions. If she got in my car and she had lathered up with even vanilla lotion, she had to go wash it off.
What?
I have told my husband, you cannot use that shaving cream anymore. Bath soaps, laundry soap. My family was so upset because we couldn't use lavender scented Tide or, all the softeners with all the smelly stuff in it. We had to go with scented everything.
You had a bland household.
Bland household. When my husband said, now that your migraines are cured, maybe I can go back to wearing cologne.
Isn't that amazing? So
Yeah.
everybody's affected.
Everyone's affected. In fact, when family came over, even when they were visiting on weekends, if we went somewhere, we drove to Houston to do something, I had to make sure that everyone knew not to wear cologne. And as a migraine sufferer, I know that everyone out there who is like me. We got so tired of asking everybody to make these accommodations for us because it just, you kind of get the eye roll. It's publicly embarrassing, personally humiliating. It's depressing for your family who are around you. Oh, we can't smile or laugh today. Mom has a migraine.
Did they have to? What about the house? Was it dark? I've heard stories about dark curtains, turn the lights out.
Have you
close the
been to my
door.
house?
No, I've heard these stories. They're like black curtains.
I do have. I have a set of shades over, doors that open off the back bedroom, and then I have brown, dark velvet curtains that go over it. My bedroom is
That
a
go
dark.
over the
Over the shades, and then I have a very dark. In fact, if you watch the video on the doctor's TV show, that brown dark room I'm in, that is my bedroom.
Okay.
So that's a reality.
So now we're gonna get bright colors.
Yeah, if I have an opportunity to build a new house, I'm planning on these great big windows
There
that
you
let
go.
a lot of light in. It's going to be amazing. I mean, it really affects every aspect of your life.
You mentioned sleeping. That reminds me of one thing that I love to hear from patients, and I'll explain why. If you have headaches that wake you up, say at 3, 4 o'clock in the morning, I have the explanation.
Hello, that's me.
Was it really?
All the time.
When you have a deviated septum and you lie flat, your turbinates swell because now you're lying flat. You're not upright. So those turbinates swell, and then it gets to a critical part of the night when the maximum swelling is there, and you have the contact between that turbinate and the septum, and you start getting a headache. And it gets severe enough, then you wake up and, it's throbbing and hurting. But when I hear that information, I smile because it tells me it's yet another clue that tells me I'm on the right track, and I know what I'm going to find when I look in your nose. I know what I'm going to see. So it's just one of those things that over time you just get used to hearing, and when you hear it, it's like, that's all I need to know. One thing that you can do, and again, it may not do it because, the deviated septums can be in the front of the nose or in the back of the nose where you can't get any nasal spray. But I tell my patients sometimes, take some Afrin or any kind of decongestant spray. And another puff, and as you're puffing it, you got to start sniffing it back before you even puff. You want to start so you can suck it all the way back. That will get the spray on your turbinates in your nose and shrink them away. And if it shrinks them away in some cases and makes your headache feel better, that's just another clue that you have what I'm looking for. If it doesn't, don't get discouraged because you may just have a horrible bone spur that regardless of how far you shrink it down, it's still going to be making contact. So don't let it discourage you. But that's one thing that people can do. Or take a decongestant, like to shrink down the turbinates. But only if you don't have high blood pressure. If you have high blood pressure, please don't do that because it'll raise your pressure even higher.
And the thing that you did for me, too, is once you determined which way my deviation was, you told me, try laying on your other side. If you're always defaulting to, I always laid on my left position, you said, try it on the other side. And so when I was really suffering from pain, I would, and it made a lot of difference. And that's another way I knew I was in the right place, because
so
all those things worked for me.
Yeah, so you can just sleep on one side. Is it one side make the headache worse than the other? And that gives you a clue, too, that it's probably your nose. Because your brain, what's your brain going to do? Your brain dilation vessel is going to dilate because you sleep on one side? No.
No.
It's the dynamic structures in the nose that do that.
Dr. Smith, what about people who want to make contact with you or get help with their migraines, but they live out of state or are not close to Houston? What can you do for them?
I'm glad you asked this question. It's very easy. Make contact with us. Certainly, you want to visit the website, get your information. I'm glad that you're here for the webinar. But most importantly, you can get a CAT scan of the sinuses from your primary care doctor and send that to me. And I can review the CAT scan, and I will get in contact with you to let you know if you have what I call a migraine imposter that I can fix. It's just that very simple. So don't worry about having to travel. Don't worry about if you need to make an appointment. Of course, if you'd rather do that, certainly feel free to contact the office. Make your arrangements to come to Houston. We're a hub. You can fly into this very easily, and we'll make arrangements to see you, make your appointment, and we'll order the CAT scan. Same day, see it, and then we can proceed to schedule you for your procedure.
The only thing that I would tell other migraine sufferers out there is I made the mistake of when I had the CAT scan done, it was a CAT scan without contrast, not with contrast. And also when you get that, it really needs to be on a CD, not the paper, because Dr. Smith can make so much more of a thorough diagnosis on a CD. Is that correct?
Well, the CD is easily transportable. You can mail it to me a lot easier. And in all actuality, the CAT scan of the sinuses, you don't need any contrast. Okay. Yeah, so that's fine. Just a CT scan of the sinuses, axial and coronal cuts to be specific. But you can get all that information by contacting the office, either by email or by calling us. And we'd love to hear from you and take care of you.
The other thing that I found out about the CT scan was, if you check your local area, there may be a lot of places offering CT scans. And it's all the same test. The results are going to be the same, but the prices can vary anywhere from $250 to maybe $1,100. Mm-hmm. So shop around.
Shop around, yeah.
It's a good idea.
Very good point. Mm-hmm. I don't want you sitting out there saying, oh, he hadn't talked about me yet, or symptoms that you've had. If you have a migraine, I am talking to you. Even though you might not have the aura, you may not have the allergies, you may not have sinus infections, you may not have anything else except a migraine that just incapacitates you, even if it's once a month. Some people have them every day. Some people have them 3 times a year. My contention is I never have headaches, and headaches are abnormal. So if you get a migraine once a year, you don't deserve to miss out on one day of your life. And I would encourage you to please send it to me, because I don't want anybody to suffer needlessly if it's an hour out of a year. Well, I want to thank everybody for coming out to the live event, and I hope you learned a lot. And I certainly want to thank Kim for helping me out today and sharing her story.
You're very welcome.
And we ask that you just share the story. Spread the information and let other people know what you found out. And let's make this world headache-free.